All right, we're good. Shaden live on everything.
Wow, you're so fancy.
Well, there's a learning curve to this, but I'd love to bring the conversations that we're having together out to the public because I feel they're so useful and relevant for the populations that we serve. So I'm going to introduce myself.
Okay.
And then we can get to you. So my name is Danielle Tarantola, and I'm the founder and director of Yoga Foundation. We are in Huntington Station, but also we are online now since the pandemic and a little bit before. And we are a yoga therapy center. So people come in to see us for healing, curing, support for all the conditions that they would normally go to other practitioners for. And usually as a last resort because they've been struggling for a period of time and they're ready to do some work themselves. So we've been in business since 1998, and you and I have known each other for about 15 years, right?
Yeah, it's been a long time.
The village is about 5 minutes. Tell us about yourself. You're amazing.
Yes. So thank you, Danielle. So I'm Shaden Ghattas. I'm a doctor of physical therapy. I still have a physical therapy practice in Huntington, just east of the village. And we specialize in helping people age 40 plus stay active, healthy, and mobile. And so that they don't have to rely on pain pills, frequent injections. We've helped a lot of people avoid surgery. We're really passionate about helping people in a holistic way, right? So we will refer people out very frequently to acupuncture. Our treatments are very sort of hands-on. So we all specialize in manual therapy. We do a very, very thorough exam for each patient. We're looking at the musculoskeletal system in a way that, I think typically PTs don't really get into. We get really very specific onto figuring out what joint is moving too little, which one is moving too much, where can we have the best effect. And we apply an intervention really focused at what our exam found. We also just have such a big respect, and we think that yoga in conjunction with physical therapy is really ideal, right? So a lot of my treatments are yoga in nature, however, being in the supportive arms of a yoga therapist who can really support you through this journey, because there's a lot of ups and downs. I mean, we treat people with chronic pain, people who've been in pain for years and years, and nothing's really been different for them. They haven't been able to see a change. We help those people. So that's where I'd say that we excel. We're kind of like the last stop, like Danielle mentioned about her practice, is that we end up being people's kind of like last resort. And this is the last stop. And thankfully we do get people better and we can help them along that journey. And part of our philosophy is to sort of marry other holistic therapies, and yoga therapy being one of them. And that's why me and Danielle are together.
Yeah. So, I mean, I think this is a very important point, why this collaboration from a modality perspective, but also from a practitioner perspective. So, physical therapy addresses pain in a way yoga doesn't. And yoga addresses pain in a way that physical therapy doesn't, which we can talk about a little bit more later on. But from a practitioner perspective, we are both, if I may say so, very experienced,
Yep.
well educated, passionate about our modalities, and determined to customize our work in a climate where one size fits all is the norm. So people are a neck pain, people are a back pain, or when they come, there's a very prescriptive mode of working with them as a condition rather than a whole person. And so I know from a yoga therapy perspective, we're taught that none of the applications of any of the tools we use are prescriptive. And we're taught that none of the applications should be used in a way that separates the disease from the human being, or the symptoms from the human being that this is residing within. So we can have 5 different students with back pain, 5 different causes, 5 different personalities, 5 different age brackets or stages of life, body types, etc. And so I appreciate about you and your practice, Shaden, that you're not a physical therapy mill in any way, shape, or form, but your treatments are also customized and respectful of the person who walks in your door as a very unique being with symptoms. So that's why I've chosen you from all of the physical therapists that I know in our community, because we have a prevailing viewpoint of working with people that meshes so well.
I agree. I think our core values are in alignment.
Yeah, so can you say a little bit more about why we chose chronic pain for this collaboration? Because we really could have chosen
Yeah.
anything. So from a physical therapy perspective, why is this so important right now?
Okay, so chronic pain is something that we specialize in our practice. I I don't know why this blessing was bestowed upon us, but it has, and we've learned so much from the amount of chronic pain patients that we've had the pleasure of helping. We think that at this point with chronic pain, we've realized through research and through our own clinical sort of discoveries that people who have chronic pain have multiple systemic problems, okay, in the body. So one of the things that we've identified that is very, very crucial, or very leading them down this path, is that their nervous system is very heightened. Okay, a lot of the patients we see are in a consistent state of flight, fight, or flight. So we talk about the nervous system with our patients. We say, listen, in order to heal, your body has to be in this rest and digest, in this parasympathetic nervous system experience. When we're stressed out, our bodies naturally go into a fight or flight. Our muscles tense up. That's why people in chronic pain usually have tension in multiple parts of the body. That's why people with chronic pain usually have tension headaches that can last for days. People usually have upset stomachs or digestive issues, chronic digestive issues a lot of times. And the reason for that is because the longer that our body is in sympathetic overdrive, or this fight or flight, the less time you have to experience rest and digest. In an experience of rest and digest, the body is the switch is off. You're able to heal. You can sleep better. You're able to get a full nights of sleep. We know that sleep deprivation is very much causing the inability to heal. So that if you're in fight or flight, you're going to have a lot of trouble sleeping. And thus, if you're not sleeping, you're not restoring. And if you're not restoring, you're not healing. So yoga is something that can teach people a very tangible, very individualized. And the way Danielle does it is that she's very intentful on the programming that she's giving to her students. She's really individualizing in the same way that we do. So I love that, because I thought I was here doing that alone, but I'm not. There's Danielle, and she's just killing it with that. So she's able to take a student and really look at their mechanics, and then her and I can talk at a higher level, and I can say, well, did you notice this, or what do you think about this? And we can now have this really educated discussion around what this patient can benefit from. And being with Danielle on a consistent basis, or even just starting out with this program that we're running, yoga therapy for chronic pain, that you can really get like some tangible tools in your toolbox to utilize when you're in pain. She's going to teach you how to properly breathe. She's going to teach you muscle activation exercises on how to really relax the tension in the shoulders, things that we go over in PT, but there's another approach here. This is another really valuable approach. And if you end up liking it, it can becomes part of your life.
It's so interesting, because I did have a physical therapist come to class recently. It was a yoga therapy for neck pain class. And when she was finished practicing, she said, okay, I get this now. Yoga therapy does a service that we can't do for people. We can't go to someone and say, okay, here, I'm going to regulate your nervous system. It's an inside job. And so that is a significant aspect of the work that I do, that I've always done. But I think that our population that we work with, which is also patients in 40s, 50s, 60s, 70s for the most part, it's imperative now. It's a different level of understanding that we have post-pandemic, because we had to be still, about how we really never can get still comfortably. And so the basis of the whole philosophy of yoga is that everything we are experiencing, for better or for worse, is subject to change. And so the tools of yoga are designed to drive change holistically in a positive direction. So while we're trained to understand pathogenesis, or the progression of the disease, let's say we don't do anything to take care of ourselves, how a disease will progress, our focal point is really salutogenesis. What can we add into the daily life habits to slow progression, to stop progression, or even turn it around completely, and if possible, and while improving our sense of wholeness, while improving our faith and our trust in our bodies, which is failing us, and while improving our well-being. And that's despite the suffering that we're experiencing. Because often I notice, and I have a feeling you will agree, that adding these appropriate, customized daily practices induce a quality of life change. Like you were talking about, better sleep, improved social engagement, more regular bowel movements, better digestion, improved energy levels. And so in that context, the patient feels better. So the pain is not what's magnified in the system anymore. It's these other faculties, these quality of life faculties that are magnifying and taking up more space in the life.
Yeah, exactly. I mean, and I would even say that the digestive health and the better sleep, that's not just like a nice to have side effect. a necessary aspect to your healing. If you ever want to dream about healing naturally and not being dependent on pharmaceuticals, then this is the thing you have to do. You have to commit to a daily practice of mindfulness, which Danielle can teach you, an ability to quiet the mind. I mean, overthinking has gone, through the roof, and especially now. We've been through, as a society, something that was really shook everybody, and I'm seeing more anxiety and digestive issues than I've ever seen. I think it's 90% of my patients with chronic pain suffer from anxiety, sleep disruption, chronic fatigue, gut dysfunction, constipation. We make people fill out these forms. We're doing a micro study in our office as to how many people are suffering with these adjunctive issues. And so we're trying to heal, let's say, a rotator cuff, right? And we're trying to get you full range of motion because you're a baseball player, let's just say. I mean, if there are so many other things going on, that tendon realistically is going to have a lot of trouble healing. If all the other aspects of wellness aren't in check. So we're talking about physical wellness, but here with Danielle, you can get into a little bit of the mental, of the inside, the introspection, the I don't want to speak to that about too much about what Danielle does because she's the expert, but I've been a yoga practitioner myself for over 20 years. So that's why I'm so in love with it as a rehab, really either an adjunct to rehab or the rehab in some cases.
Yeah, I think that many of the tools we use in yoga, either people will never have used before or never used before in the way that we're using them. They're literally foreign. So they were created at a time in history when pain management was a process, when opioids and nerve blocks and cortisone injections were non-existent. So when the central focus was also the mind, that was the most significant tool that ancient people had to use for their healing.
Absolutely.
And when we bring that into the modern times, I mean, yoga is at least 5,000 years old or older. But that's why it's so potent for anyone who's practicing it in its depth and breadth, is because once the mind is engaged, we can use it as a tool, because we're really at the mercy of our mind otherwise. And so now the mind becomes the entity that we fortify to alleviate pain. And so I think in the West, we know this as the placebo effect. So when you really believe in something to the point where you're having faith in it, that's what we call the placebo effect. So it's not like what's happening in yoga is non-existent in Western medicine. As a matter of fact, the most valued research studies are largely based on this concept of double-blind placebo tested methodologies. So I noticed that all the practices really of yoga, and this is the tool that's meant first, it's faith, it's trust, it's conviction in ourselves. They're all based on that. And so they're meant to, at their core, improve our sense of self and our sense of, I can do this. And so, if we look at how pain is handled for the most part, for all of us, it forces us to go outside to seek cures. My knee hurts, my neck hurts. Everyone's coming into your office for a cure, or going to the doctor for a cure. But what yoga is asking us to do is to go inside and sort of find the spark of life that's in there. It's really hiding though.
Yeah.
So really what happens is the mind either facilitates this process or not, or not. And so can you, the question that I have for you, because maybe some of our friends who are listening have not tried physical therapy yet, can you describe some of the tools that you use?
Sure. So we attempt to first do a scan of the neurological system. So we will try and decide whether we think your nervous system is in fight or flight. We're deciding whether there's a nerve compression, whether there's, and whether that compression is happening more locally in the neck at the disc level, at the nerve root level, or at a nerve further down the line. So we do very specific testing. We do vertebral artery testing. We'll do, we'll test your reflexes, your sensation, strength testing. We're coming up with a really sound like pathoanatomical diagnosis and a biomechanical sort of answer for why you're in trouble in the way you are. And so our treatments then, we're obviously, because we're all trained in manual therapy. So if I find that there is a specific joint that is stuck in a specific position, causing you to not be able to turn your head to the left, to look over your shoulder, to back up your car potentially. And we have a few people that have that problem, that we can mobilize or manipulate that joint with our hands and give you the feedback to, hey, here's the segment where there's the biggest restriction, and here's what I want you to do at home, repeating certain things at home so that we can facilitate healing at that segment and regain range of motion. It's very difficult, that's why this marriage is really, really nice, because it's very difficult to, go into yoga and be able to do certain things when we know at one segment there's something that's stuck in one direction. So we can kind of directionally fix that with our hands, and we even do soft tissue massage. We have an acupuncturist on staff, and then that next step would be the yoga, that I can say, okay, Danielle, here's what I found in my exam, go ahead and do your exam and let me know what you think. But maybe we can come up with modifications for that progression into yoga, that modifications that are really relevant to the person, because we've done such a thorough examination. Some of our other interventions include like biofeedback, so that you can really figure out, which muscles are working properly. We do pelvic health as well. We do help women with various problems, incontinence, pelvic pain. But yeah, and then the strengthening, we'll come up with a strengthening kind of plan that's very individualized to yourself and to getting you back to where you want to be. And we're very, very cognizant on what your goals are, right? So our intake will be, what is it that you want to be able to do, right? This is not us trying to just have you we're not making things up. We want you to come in with real goals and say, here's what I want to be able to do. Here's when I have to do it by. Okay, well, let's come up with a plan. And it might include acupuncture, and it might include, Danielle for yoga, but that's what a holistic model really looks like. There's no egos. You're not afraid to refer out because you're afraid the person won't, want to be with you. It's not what it's about. This is holistic. This is treating the whole person.
Right, and we're clear about our scopes of practice and what's within our capacity to treat, and that won't be everything. So that's why we actually need each other. And more than we need each other, the patient needs us. So I love this idea of assessment. And I feel like one of the downfalls of yoga as it's practiced today is that there is no assessment. There's this small group of practices that people are used to, and they basically without knowing anything about it. So we also do a thorough assessment, but the tools that we can expect to see in yoga are a bit different. So I think they deserve a little bit of attention, because pain is sneaky and is all encompassing. So what happens in the body won't stay in the body. It'll store in the mind. And what happens in the mind doesn't stay in the mind. It will lodge itself into the body. So the tools that we use, breathing and meditation, they include certain gestures that can be done with the body, as well as lifestyle recommendations, focusing diet. These tools influence different aspects of the system. So when, and something else that I want to talk about, which is really important, one of the most powerful definitions of yoga that I know is yoga is relationship. So beyond these tools that people are using, it also includes adoption of certain attitudes, which can be very helpful for somebody who is suffering with pain, because pain is debilitating and it can really quickly spread out. So attitudes like nonviolence, or attitudes like contentment, or attitudes like appropriate daily discipline, so social disciplines, personal disciplines, and these practical philosophies that I will include in our course. Every week will include a definition of yoga, a concept of yoga that is helpful. What is dukam? There's this concept called dukam, which is, it's really pain. It's when the space inside of the body has contracted, right? And then how do we address this from a perspective? So the body, we have the mind, we have the behaviors, we have energy levels, we have emotions, and the different tools of yoga are meant to address these different dimensions. So you can't expect to do something like, I don't know, Trikonasana, like
That yellow Japanese, right?
having anything for depression that's associated with chronic pain. It doesn't work. So the tools that would handle, that would give support in a state of hopelessness that may have developed from pain would be more meditative based, breathing based, and even sound based. So sound is also a big part of our practice, as we've discussed. But these are the kinds of tools that get into what's underneath the pain, so that it can start to dissipate.
Yeah.
So I just want to ask anyone who's joining, and I'm going to take a quick look if you have any questions that you would like to ask us. Meanwhile, and also just to share that we are collaborating on a course that's called Yoga Therapy for Chronic Pain, and it starts in November 12th. Next Wednesday. The link is in my, can you pull it up, Shaden? I forget the exact date.
Yeah.
But the link is to register is on my website, yoga-foundation.com. It's also in the Instagram link in bio. Anyone who is coming in is going to get intake with myself, and Shaden is going to come in and talk on the first class and on the last class, and we'll have group classes each and every week. We get practice to take turns, so that
She's all good.
and by the November 10th. So it's Wednesday, 6 consecutive Wednesdays at 10 a.m. Thank you.
It's all good.
And so you'll have both of us at your disposal. And any questions, but let me ask you one more time if you have any questions. Otherwise,
Yeah.
Anything else you'd like to say before we
No, I mean, thank you for choosing me, and I'm really excited. I mean, I know we've always been friends, but you know, this is fun to do this together. And I think we're going to help a lot of people. I think it's going to be something very different and very needed. So I think it's going to be really successful. I'm excited.
I feel the same way. I'm really feeling like it's the right time.
Yeah, yeah.
And you know, I always remember feeling when I was in India that most of the people that are going to Krishnamacharya Yoga Mandiram, where I learned, they are being referred by their doctors and or their physicians or their practitioners. And I love now that there are certain people in the world like yourself who are much more open to using complementary modalities. Very thankful for you because you will
Thank
change
you. I just got, no, I really
my
got it about 2
um,
Christmases ago.
illness
And this is the
diabetes.
first
So
time
I
I'm
really
really.
value
You
your
know what? I was walking out. I
Thank
was
you.
walking out and I was saying.
I think I don't think there's another way. I think that we need to move past some of the strict sort of, like you said, kind of Western medical model. I think this is going to be really huge. So thank you.
it sounds like it's bumping over there, so get back
It
to
is.
your thing.
I don't have a room currently, so sorry about that, guys.
That's a good thing. I'm sure you're full of patience.
Yeah, it's good. Thank you,
Thank you so
Danielle.
much.
All right, I'll see you soon.
Yeah.
Okay,
Bye.
bye.